Hello everyone. Today we are going to discuss MCQs on the topic of airborne precautions. This information is useful for healthcare staff training or education purposes. Question number 1. Which of the following diseases require airborne precautions? We have 4 choices. A. Influenza, B. MRSA, C. Tuberculosis, and D. Norovirus. We are going to wait for a few seconds for the answer. And the answer is tuberculosis. TB is spread via airborne particles and require airborne precautions. Question number 2. What type of room is required for a patient on airborne precautions? A. Regular patient room with door closed. B. Single room with positive pressure. C. Single room with negative pressure ventilation, that is the airborne infection isolation room. And D. Cohort room with 2 to 3 other patients. And the answer is C. Single room with negative pressure ventilation. Airborne precautions requires a negative pressure room to prevent the spread of infectious airborne particles. Question number 3. What type of personal protective equipment is mandatory when entering a room of a patient on airborne precautions? A. Surgical mask. B. N95 respirator or equivalent. C. Gown and gloves only. And D. Face shield. And the answer is N95 respirator or equivalent. An N95 respirator filters out airborne particles and is essential for airborne precautions. Question number 4. Which of the following is not transmitted via the airborne route? A. Measles, B. Varicella, C. COVID-19, and D. Clostridium difficile. And the answer is C. Diff. C. Diff is transmitted via the contact route, not the airborne. Question number 5. A patient with suspected measles is in emergency department. What is the most important action? A. Place in a shared waiting area. B. Start droplet precautions only. C. Immediately place in an airborne isolation room and wear N95. And D. Give antibiotics and delay isolation. And the answer is C. Immediately place in an airborne isolation room and wear N95. Measles is highly contagious via the airborne route. Rapid isolation is essential in this case. Question number 6. Which of the following steps is most important before donning an N95 respirator? A. Putting on gloves. B. Tying back hair. C. Ensuring the N95 has been fit tested. And D. Checking the room pressure. And the answer is C. Ensuring the N95 has been fit tested. The proper fit testing ensures the respirator seals correctly for effective protection. Question number 7. After exiting a room with airborne precautions, what is the last step in PPE removal? A. Remove gloves. B. Remove N95 respirator outside the room. C. Remove gown. And D. Perform hand hygiene. And the answer is B. Remove N95 respirator outside the room. N95 should be removed after leaving the negative pressure room to avoid exposure to airborne pathogens. Question number 8. Which of the following best describes airborne transmission? A. Direct contact with the infected surfaces. B. Large droplets that fall quickly. C. Small droplet nuclei that remain suspended in air. And D. Bloodborne particles. And the answer is C. Small droplet nuclei that remain suspended in air. Airborne transmissions involves tiny particles that can linger in the air and can be inhaled. And that's all for today. Thank you for joining me.